Dr. David Perlmutter, welcome to the Living Experiment COVID edition, which we're doing live these days, although not live today because we got bucked by the internet or Facebook or Zoom, I'm not sure which, but I'm so glad to have you with us.
Well, I've been looking forward to our time together, Pilar, as well. So thanks for having me.
Oh, it's my great pleasure. I want to tell people that, I've been following your work for, I don't know, the better part of a decade, I guess, because years ago, I asked Dr. Mark Hyman, who should we be covering in Experience Life magazine? Who's doing cutting edge work in functional medicine? And he gave me maybe three names, and yours was one of them. And I immediately began reading your work. And it's funny today when I went to find copies of your books so that I could flash them on screen, I realized I've lent all of them out, except I found this one legacy book, Power Up Your Brain. But your current book, a lot of people are reading right now, called Brainwash. A lot of folks have read your book, Grain Brain, which was really a groundbreaking book about the impact of grains in physical and mental and emotional health. And you are widely known as the leading functional neurologist, I think, in this country. You've got a number of New York Times bestselling books under your belt. Congratulations, by the way, on your most recent, debuting, I believe, at
Thank
number
you.
one. I see it in the background there. So I wanted to do a couple of things today. We only have you for a limited amount of time. We both have things that we've got to do with hard stops. So a couple of pieces, I want to first make people aware you're doing some really incredible work during this time of pandemic to educate folks on important scientific topics, help them understand how their baseline health contributes to their general immunity and to their vitality and resilience. What sparked you to begin doing these live streams? And tell me a little bit more about how you're reaching people during this time of intense need.
Great question. And one of the venues that I am happy about is what we're doing right now. So I've had the great honor of having many people like yourself reach out to me and be able to spend time together. And that's been very helpful around the world, whether it's in South Africa, Australia, Europe, or here in America. And I also, for whatever reason, chose Facebook Live as a platform, and that's gone gangbusters. In trying to figure out why, I think it's because I'm just doing the very best I can to, in a very reasonable way, look at what the science is telling us and give people actionable material so they can make modifications on the front end of this, hopefully to reduce the risk of contracting this virus in the first place. But even beyond that, should they become infected, hopefully their outcome may be improved, especially as we learn more and more about how it is that COVID-19 is able to manifest so aggressively in some people, and yet in others, there is no manifestation whatsoever. And those attributes for the individuals who have minimal to no symptoms are beginning to make themselves clearer as we move forward. One very interesting study that was published just yesterday demonstrated that, we're aware of bad outcomes associated with people having type 2 diabetes, obesity, coronary artery disease, other metabolic problems. But what was really fascinating in the report that came out yesterday, it's a bit technical, but you actually talked about it in Healthy Deviant, has to do with this non-alcoholic fatty liver disease. And this is a change in the liver that is not associated with consumption of alcohol and really is a manifestation of our lifestyle choices. We know, for example, that there's a dramatically increased risk of this NAFDL, non-alcoholic fatty liver disease, in people who consume a lot of fructose, high fructose corn syrup, for example. And the study that just came out showed that the risk of bad outcome with COVID-19 was six-fold increased in people who had markers of this non-alcoholic fatty liver disease. So that connects two very important dots, doesn't it? Lifestyle choices and bad outcome. So we're all doing our best not to get the bug, but you know what? We may get it. We're washing our hands, we're social distancing, we're going through all the things. But nonetheless, if we slip up somewhere or something happens, something arrives on a package, and we make a mistake, we're probably going to get it. It's been anticipated that as many as 80% of us will eventually experience this infection. That said, what is very important then is what happens next. Do you have mild symptoms or do you end up on a ventilator? And I'm a believer that we can make choices on the front end today to improve our general health that will also play out as a better outcome as it relates to what happens with this infection. I want to be so clear to indicate that that mentality or that statement has not been yet validated. We're looking for that. But when we know that certainly there is clear evidence that those with underlying medical conditions do worse, then it makes sense today to do whatever we can not to get those underlying medical conditions. And if we already have them, then to make the important lifestyle choices that can help calm those things down. We know that one lab marker that bodes poorly in terms of outcome is elevation of the blood sugar. Now, that's an easy one for us in the world of lifestyle management. Blood sugar is really not challenging in terms of management with lifestyle choices. Predominantly, the major intervention here is dietary change. When we know that high blood sugar generally correlates with bad outcome, then what can we do right now to keep our blood sugars normal or maybe a little lower than the so-called normal levels that seem to be what mainstream medicine is talking about? So what I'm saying is we can make choices right now in terms of lifestyle, in terms of not just diet, but sleep, meditation, exercise, nature exposure, gratitude journals, you name it, that I believe can absolutely impact our outcome if we should become infected with COVID-19.
Wow. Thank you so much, Dr. Perlmutter. I think that you just encapsulated several episodes that we've done that are these COVID editions, talking to different experts, folks like Dr. Gregory Plotnikoff, who is a vitamin D expert and a functional nutrition expert, Dr. Terry Walls, who talked about the impact on our immune system and how autoimmune conditions can impact our baseline resilience or our vulnerabilities to something like a contagious disease like this one. And I think that this overriding message that I'm hearing repeated as I talk to folks who are smart about how the systems of the body interact is that you can't do just one thing. Both for the betterment or the worsening of your general vitality, whatever you do that lowers your general health and your vitality and your resilience lowers your immunity. And it also radically increases the chances that you will have a poor outcome in the event, the likely event in the long run, as you point out, that we become infected with this or another contagious, nasty, virulent bug. So I think it's really great that we can now, while we're waiting for all of the science to show us all of the functional reasons that this happens, I think it's clear that the safest tack is going to be do everything you can to reduce your risk by simultaneously raising your general health and vitality, which will only have positive side effects in every other part of your body mind. And one of the things I love about your work is you make such a strong case for how the physical health of the body impacts your mental health, your emotional health, your cognitive function. And when we're going into I think what we can agree is going to be a proactive period of elevated stress and uncertainty and anxiety for people. Taking these steps to manage your blood sugar, do the things you're talking about, getting outdoors, getting enough sunlight, getting enough sleep, having social connection, all of these things also really help people manage the emotional and mental stress that they're going to be under. Talk a little bit about how that interaction, for folks who may be new to how the body impacts the brain, not just the mind impacts the body. Explain that a little bit for folks who might be new to
Well,
the concept.
there's quite a few things here that we can unpack. We know that there is this powerful we call bidirectional relationship between body and mind, and even gut, for example, and mind. Written quite a bit about that, explored that over the years. And I think it's extremely valuable to get to the point of recognizing that what we expose ourselves to in terms of emotional, psychological, and on the upside, let's say spiritual, impacts our immune system. What I'm saying is we can make choices, not just with respect to our nutrition, which is obviously very important, but how we view the world, how we choose to expose ourselves to what's going on around us, has a very real play as it relates back to immune function. As an example, the more we tune into fear exacerbating media, the more it will increase our body's cortisol level, and that directly impacts the functionality of our immune systems. So, a very simple maneuver to improve immunity is to back off the television a bit. It's certainly worthwhile to be informed about what's going on globally, nationally, and in your community, and to check in with that either online or perhaps via television or whatever medium a person chooses. But to be glued to the sensationalist news day in and day out enhances your fear response, and as such changes your immune set point, changes the diversity of bacteria living within your gut, and has a direct effect in terms of altering the permeability of the gut lining. What does that do? Two important things. It compromises immune function, and it also exacerbates inflammation, which is what we don't need to go along with this infection. So there are a lot of lifestyle factors that really have an important bearing. I've been asked multiple times in interviews in the past several weeks, what is the most important supplement that you should emphasize right now for your immune system? And the one I choose is called sleep, SLEEP. And it always raises eyebrows because people were looking for the vitamin D or the bioflavonoids, whatever it may be. And in terms of ranking, there's nothing more valuable for your immune system than getting a restorative night of sleep. And it works both directly in terms of immunity and somewhat indirectly through cortisol, but it also works much more indirectly in terms of how sleep influences the brain function and what areas of the brain are active. And that really gets back to your question in terms of the brain-body connection. When we don't get enough restorative sleep, we tend to activate the fear center of the brain called the amygdala. Not only are we then the next day in a higher state of fear and feeling threatened, but in addition, our decision making is compromised. We make more impulsive decisions, decisions that don't consider what the future consequences will be. It further locks us out from empathetic behavior. So it's not only bad for the individual, but bad for other people that person may come into contact with. So you're right. I mean, so many of our day-to-day choices are important in terms of how we ultimately will respond. You mentioned getting out in nature, exercise, gratitude journal, meditation. All of these things we talk about in Brainwash as being powerful levers that we can pull that can work harmoniously and help create and help feed on each other to inspire us to be even more dedicated to a program that will ultimately benefit us even once COVID-19 is said and gone. I mean, what is
Absolutely.
the downside of doing these things starting this afternoon? None. The upside is better health, and that's what we're looking for.
Oh, absolutely. Well, and that idea that there's sort of a positive cycle of good things feeding on each other, I always think of it as kind of a spiraling up effect. I talk about the vicious cycle of the unhealthy default reality in my book, The Healthy Deviant. And I know in your book, you guys really did a great job of describing how our society, manipulates us, programs us, gives us these norms of behavior that are really pretty crazy making and that devolve our body minds, really degrade our ability to cope with our circumstances. And that creates that what I call the vicious cycle of the unhealthy default reality. And yet you're right. in any moment, starting today, starting right now, you can do things that reverse that cycle and begin building your vitality, your immunity, resilience, your awareness, your capacity to cope with the conditions on the ground, whatever those are. And I really think that that's lost on a lot of folks in our current culture of health and fitness media. We've led people to believe that they need to have six-pack abs and a bikini body in order to be considered healthy. And to get healthy, you need to go on these crazy yo-yo weight loss, calorie restricted diets, and you need to do these wacky workouts. And you just are always losing at trying and failing to make your way with those kinds of interventions. One thing I really love about your work is you do offer people really doable entry points that have very high leverage returns. You know, getting something out of your diet, for example, gluten, which you talk a lot about, gluten containing grains and other grains having a negative impact on people's gut health, on their immunity, inflammation. Just removing one thing that you are starting to understand you might be sensitive to is a really great experiment in feeling better and reversing that cycle. I feel like so many times if people could just feel a little bit better, they could leverage that capacity to make the next change and the next change. It's when they get too depleted and too depressed, they don't seem to be able to have the agency to intervene on their own behalf.
Well, I would say, if not now, when? So today is a great day to get started. And the concept that you're bringing up is something that we call a feed-forward cycle, whereby one bad thing leads to another. Let me give you an example. A bad night of sleep, a non-restorative night of sleep, is associated the very next day with a 60% increased activity of the amygdala, the impulsivity center of the brain. So what happens? You don't get a good night of rest. The very next day, you make crappy food choices. You gain weight ultimately, and because as this keeps going, the more weight you gain, the more that will compromise your ability to get a good night's sleep, the more you are going to be locked into making poor decisions. So that is what we call a feed forward cycle. It gets worse with time, or as you described it, a downward spiral. But we can embrace this, looking at this glass, this whole notion of feed forward spiral from another perspective. And as you just indicated, take advantage of simple entrance points or on-ramps to the freeway of good health. So as we described in Brainwash, so many things that people could pay attention to, oftentimes it's good just to concentrate on one thing that might be really powerful for a person, that would then pave the way for better decision making as it relates to other lifestyle choices. Isaac Newton said that a body in motion tends to remain in motion. And what I think that meant was, if you get physical activity, then you'll tend to be more likely to engage in physical activity. What are the mechanics of that? Well, the more exercise you get, the more you distance yourself away from impulsivity and towards the prefrontal cortex, making better decisions like, I think I'm going to exercise again today. So that is a feed forward cycle in the positive direction.
Yeah.
We are beginning fleshing out a program for healthcare providers through the Institute of Functional Medicine, where we're going to be looking at when, for example, a patient comes to see a practitioner who is overweight and has type 2 diabetes. At the initial examination, the intervention has nothing to do with changing that person's diet, where that may raise eyebrows on the part of the recipient of this information, saying, no, I came here to lose weight and to get my blood sugar down, and we're not even going to talk about that this week. No, because we need to create in that person a better decision-making framework, put that person in a better state of mind, if you will, to then make better decisions once we give that individual a better diet. So it might be that at week one, we're going to say, what we're going to focus on this week is doing everything we can to help you get a better night's sleep. What does it mean? No TV after dinner, no screen time with blue light after dinner, no caffeine after 2 p.m., whatever it may be, and just work for 1 week to get a better night's sleep. Why? Because that tends to allow the brain to access the higher level adult in the room decision maker, so that next week when that person comes by and we give that person the diet and the physical activity recommendations, he or she might be far more likely to follow through. We know that one of the most challenging things about the practice of medicine is that we do everything we can to learn as much information as possible. We go to every conference, read the journals, we do our very best. Then we do our very best with respect to our communication skills to interact with our patients and give them this incredibly powerful information. But the breakdown happens at step 3. It's the utilization, it's the implementation of that information. That's where the system breaks down. 50 to 80% of the information that we are giving to patients isn't acted upon. So it's really targeting this decision-making apparatus that needs attention moving forward. And it's well beyond decisions as they relate to health. It's certainly decision-making as it relates to what we do these days in terms of washing our hands and social distancing. But it could be decision-making in terms of our investments. Are they impulsive, or are they looking at long-term return, for example? All of our decisions can either be impulsive, I want this right now, or take a step back, take a deep breath, and think about how this decision will influence you in a week, in a month, or in a year.
Yeah. Well, and I think too about how many decisions people are making about their relationships in the context of, kind of a powder keg environment of people being stuck inside and not eating well and staying up too late watching scary news, and then, dealing with all of the other stresses of their lives. But also, when people begin to relate from that reactive place, oftentimes that's when relationships start to fall apart. And when our relationships start to fall apart, we have even more stress and strain, more inflammation, and so on. And I have a good friend who's a couples therapist who said her business has been booming since this social isolation, sheltering at home thing started. And I think about that too, how the decisions that we make about our diet, our exercise, our sleep, our social connections, they don't happen in a vacuum. They happen in the context of our daily relationships with each other in our own homes and families, also in our communities. And I always take that social perspective of how are we functioning as a society when 90 some percent of us are not really doing very well. I talk in the book about the fact, and I'm sure you're aware too, of the Mayo Clinic proceedings research that reported that 97.3% of US adults aren't practicing even 4 of the most basic healthy habits. And you got to think about what happens in a culture when the vast majority of people are really not very healthy and happy, and are then co-creating the structures of our society and the norms of our society together. We need more healthy, happy people to sort of turn that larger feed forward cycle around. And I feel like so much of your work is really starts with you as an individual, but also helps you understand, that this is all of us kind of together figuring out how medicine needs to change, how our societal norms and standards and behaviors need to change. But we can't do that by trying to do all of it at once. You can really only start where you are, make the changes that you can make today.
Totally. And no one expects anyone or even conceives of the idea that you're going to do it all at once. Find whatever is the on-ramp for you,
Yeah.
and that will then pave the way for the next set of interventions that you can then incorporate.
Yeah.
We all have the books. Everybody buys the latest book. You watch the PBS special, you buy the book, and great, you have shelf loads of books, but they are useless unless you implement what they're talking about.
Yeah.
Now, it might be a paleo diet, a keto diet, a vegetarian diet, vegan diet, you name it, all have their upsides and can be valuable, but they're useless until you actually commit. You make the decision that, yes, I am going to do this today. You inferred something I think that was very important a moment ago, and that is that here in America, we are not as connected and as healthy as perhaps people are in other countries. It was a big surprise, at least at first, when we began seeing individuals in America, younger individuals ending up in the hospital, ending up in intensive care units, which was not the experience in other countries to the degree that we've seen it here. And what was perplexing was the fact that, well, gee, these are young and healthy individuals. Well, young they may be, but healthy is another story. The young people in America, in comparison to many other countries, are not as healthy. We have, extremely high rates comparatively of type 2 diabetes and obesity in younger individuals here. And so the outcomes as they related to this infection should, in that context, therefore not be as surprising. One of the biggest points that we tried to make in Brainwash is the development of this idea of what we call disconnection syndrome, which is, the idea that we are existing in isolation that has profound health consequences. And this may seem like what, in our current environment, what would be best for us. But social distancing does not mean social isolation. And I think it's very important that we delineate that while we physically need to separate ourselves from other people, we don't need to completely isolate ourselves from the interaction, because it is the interaction that is salubrious. It is the interaction that brings us peace and calms down our amygdala and therefore fosters better decision making. How do we interact? Well, we can interact digitally like you and I are at this time. There are ways of interacting with people at a respectable distance that is certainly something we can achieve. But I think seeking out connection right now is a good thing, and following through on connection is a good thing, whether it means calling a family member on the phone or however you want to do that. So, we are by nature, man is a social animal, correct? And we become more interactive and more social and interdependent during times of threat, during times of crises. Unfortunately, that proves to be a bit of a negative towards outcome right now as it relates to this particular event, as opposed to other types of crises, be they, climatic crises, whatever it may be. We come together. Here, we have to be creative in our reconnection and find other ways of making that happen. At the same time, we extrapolate this term disconnection syndrome to not just represent the disconnection that we have from each other, but even at a more mechanistic level, the disconnection that we have from the prefrontal cortex, the part of our brain that allows empathy, that allows forward thinking, that allows understanding the future consequences of the choices that we make today. We become disconnected from that prefrontal cortex, and that prefrontal cortex disconnects from the more impulsive amygdala, the amygdala that makes impulsive decisions that are self-centered and really an area of the brain that fosters tribalism or an us versus them mentality, which is what we don't need right now. We need the adult back in the room. We need the prefrontal cortex to calm down the activity of this amygdala. We reestablish our connection. We reconnect to the prefrontal cortex when we have a good night's sleep, when we meditate, when we experience nature, when we exercise, when we're involved in a diet, for example, that helps reduce inflammation. All of these things reconnect us to the better decision maker and the part of the brain that lets us be empathetic, not just for other people, but even for our own future selves as seemingly a disparate sort of concept.
I think about how important that is in the time that we're moving into now, where we're going to be called upon to restructure our lives, to restructure our systems and our societies, to rethink how we do everything from educate people to the correction system. And, at the basic level of me as a one person, I know when I haven't been eating well, when I haven't been sleeping well, when I'm inflamed and exhausted and depleted and overwhelmed, I make terrible decisions, and I often talk about how we're just terrible judges of our own capacity when we're operating at that level. And we do desperate things, short-sighted decisions, we break things that don't need to be broken, we fail to build new habits and things that might pull us out. And so there is a kind of self-arrest that I think we have to advocate for, we have to practice in our daily lives to resist being drawn down by the difficult circumstances that we have, including this social distancing element that I think you just spoke to beautifully. My podcast partner, Dallas Hartwig, who I'm sure you know, says it's important to think about it as immunological distancing, not social distancing. It's immune systems that we need to keep separated from each other. But I also think that, when we're in this place where we think it's our civic duty to watch hours and hours of negative daily news in a 24-hour news cycle, we are basically making ourselves crazy, and we are misusing the available capacity and energy and focus that we have, that we could be redirecting toward building up our systems. And instead we're breaking them down, which I fear leaves us even more vulnerable and more immunologically compromised than we would have otherwise been. So it's ironic to me that so many of the things that people are choosing to do because they're being programmed to do it, like binge watching television, really mass consuming news, comfort food, eating things that are supposedly comfort foods like macaroni and cheese and potato chips that are just elevating their levels of inflammation. To realize that there's more purpose now than maybe at any other time in our lives to really make responsible decisions and intervene against those unhealthy patterns on your own behalf and for the benefit of the people around you. Because we do need more healthy, happy people to kind of bail out the next phase of our future. We need to create something better than what we've built, not just sink more deeply into our anxiety, our depression, our desperation, our tribalism, and so on. Plus which, let's face it, you see this as a doctor, I'm sure, that our healthcare system really is a fragile system at best. It's an overwhelmed system, even under the normal circumstances. But when crises like this hit, A, the system cannot hold, and B, it's the last place that you want to go and spend any time if you can possibly avoid it. So there's some self-preservation there, as well as like, hey, let's do the right thing by our healthcare professionals and not throw more bodies into that system right now. Have you been in touch with medical professionals in your circles? I know most of them are probably functional physicians that aren't practicing in the emergency rooms right now, but what are your thoughts about how our healthcare system is going to cope with this current and future reality?
I believe that the fact that healthcare system in the United States, the fact that it is an incredible misnomer is the reason we're in the fix that we are in. Our healthcare system in America has nothing to do with health. It has to do with treating diseases. It doesn't focus on keeping us healthy. If it did, then our response to this virus in terms of outcome would be dramatically different. We would have less chronic disease. We would have less of these severe outcomes. And to be truthful, we say it's a health care system. There's very little care involved here in a 7-minute interaction between a patient and a physician with a screen and keyboard interposed between the two of them. There's not a lot of care that happens in that environment. So had we been involved in actually looking at health and fostering health in our population, as opposed to simply treating diseases once they have occurred, then our response, what we're seeing going on in terms of the dreadful numbers in our country in comparison to the rest of the world, which we can't even compare ourselves to any other country. There was a time when we looked at Italy and thought, gee, look at how devastating this virus is in Italy, and now look, where we are in comparison. So I think that moving forward, a really important message would be one that says we learned that outcome was very much dictated by underlying health conditions, Therefore, let's pay attention to that. Let's learn from this experience and help people regain their health on the front end. Then the next time something like this comes around, perhaps our response will be more positive. It makes sense from an economic perspective if less people are suffering from chronic degenerative conditions, which are, according to the World Health Organization, the #1 cause of death on the planet. What that means is that these conditions, which are brought on by lifestyle choices, represent the main reason people die on our planet. Not wars, not infectious diseases. It's the chronic degenerative conditions like diabetes, coronary artery disease, Alzheimer's, and even cancers. And primarily, these relate to our lifestyle choices, most importantly, the foods that we eat. I think Food Fix, a book that was just put out by Dr. Mark Hyman, makes it very clear that this has environmental impacts, it's having economic impacts, it's certainly having health impacts globally, the likes of which we could never get our arms around. And let me take that theme a little bit deeper, because a few moments ago, you and I had a discussion about the role of inflammation in changing how we think, how inflammation locks us into more impulsive decision making, more tribalism and us versus them mentality, more self-centeredness, and less empathy. Inflammation is brought upon us to a significant degree by the westernization of our diets. Eating a diet that's higher in refined carbohydrates and sugar and ultra-processed foods fans the flames, literally, of inflammation, and therefore changes how we see the world around us and our decision making as it relates to not only ourselves but to others. That said, we now understand, it's quite clear, that our modern Western diet is becoming the global norm, meaning that the globalization of this Western diet is changing the mindset of people around our planet, making them more impulsive, less forward thinking, more concerned about us versus them, more fearful than ever. So to see how we as a global population are changing in terms of our behavior may well have to do with this sudden shift, unlike anything humans have ever experienced in the type of nutrition that we are consuming.
I love thinking about the potential for forward progress on the basis of that reckoning. I just was tweeting yesterday about, what are our ideas for a really large scale health stimulus plan? Something along the lines of the New Deal, the GI Bill, but really focused on let's shift the constructs of our society that have made it easier to be an unhealthy, unhappy person than a healthy, happy one. Let's deal with the economic conflicts and the industrial conflicts that have caused it to be more profitable to produce and heavily promote unhealthy products than healthy ones, and that frankly have made it really expensive for people who choose to get healthy to go in search of those healthy choices and behaviors. Insurance covers things like stents and amputations and dialysis and scooters for people who are no longer mobile, but you can't really get financial support for things like a health coach or a healthy cooking class or a gym membership or yoga classes or meditation classes. And I think we're going to have to reassess our priorities as individuals and as a larger culture if we're going to get ahead of this. And globally, absolutely, because up until now, we've been exporting our lifestyle. My hope is that we start to import some of the healthier lifestyles that still exist in some communities around the globe. Maybe together we can take the best practices that we have for supporting human health and begin integrating them more consistently. At least that's my dream. That's my hope, my vision for the future.
I hear you. And I think this current experience is a very obvious display of how dysfunctional our so-called healthcare system in America really is. When we see these numbers, they speak for themselves in terms of the number of people infected and the death rate in comparison to other countries. Germany, for example, comes to mind, where there is everybody has some form of health insurance. and they have been way ahead of this in terms of testing, in terms of home visits, in terms of the virus. So, when we see that healthcare in the United States is, while it is by far and away the most expensive per capita of any country on the planet, ranks, according to the World Health Organization, at 23rd in terms of developed countries. We're we're wasting a lot of money. We should be doing things from a preventive perspective, as you well described just now, and that has financial rewards for us as a population, though it may certainly impact the bottom line for corporations that would profit from us making unhealthy choices. This is not, conspiracy theory. It is a statement of what is going on. We know that our choices are manipulated by our online experiences, for example, that we're constantly bombarded by messaging telling us we're not good enough, and we can satisfy ourselves by the quick fix that we may see described, whether it's for weight loss or whatever our shortcomings may be perceived to be. So it's really about regaining the ability to take our own control and not be at the mercy of the manipulation that happens by corporate interests who would love to have you as their consumer on the books.
Yeah.
And our time that we spend, for example, online, where we put our attention is extremely valuable. It's why we have pop-ups and clickbait to direct us away from what might be otherwise important information for us towards the monetization of our interest. So,
Yeah.
I think once people become aware that this is happening, they can regain some level of control. And it all starts with actually rewiring your brain back to the prefrontal cortex, which truthfully, we started talking about in the book that you first held up, The Neuroscience of Enlightenment. That was quite some time ago. And the power up your brain that I wrote with Dr. Alberto Villoldo. So, but hey, this has been something that people have been talking about for centuries.
Yeah. We're going to be returning, I think, to examining all of these sources of wisdom about how our body minds work. And frankly, a lot of ancient cultures seem to have a much better sense of what was required of us to be healthy, happy people, as I point out, and you have too. Like, the entirety of the evolution of humans really happened in hunter-gatherer societies, and we have a lot to learn from looking back at what allowed our ancestors to be successful enough to pass on their genes now. So, and I know we have to let you go because you've got another call, and I've got the Healthy Deviant, day 14 of the Healthy Deviant adventure happening next. But a couple things before we close. First, I wanted to just point out and to emphasize what you were talking about, our sick care system, and how that whole construct is really designed to keep people in a dependent state with care that really just helps them to manage and treat the diseases at a very symptomatic level, not address the root causes of those problems, which that happens at the lifestyle level. And I would love to talk to you. I would love to have another session with you and talk specifically about some of the interventions that you have been so successful using with folks with migraines and cluster headaches, like my friend Alan, who you helped so much, reversing 17 years of excruciating suicidal pain with relatively simple interventions, that in the course of his regular interactions with the sick care system, he was basically told there was nothing that could be done. And I think we will have to re-empower ourselves. Will you come back and talk to me again specifically about some of the neurological interventions and the body-mind interventions that can break people out of their dependency on the
You
system?
don't have to ask twice.
Okay.
I am dedicated to you, Pilar.
Oh, thank you so much, Dr. Perlmutter. And thank you for taking the time to talk to us today. We'll get back in touch and schedule a follow-up soon. And in the meantime, thanks for doing all of the beautiful work you're doing, helping people get through this pandemic period.
Thank you, Pilar. Great to see you again.
You too. And where do people find your stuff? I want to make sure people can locate your website, and I don't want to get it wrong. Tell people how to find you.
Best website for me is drperlmutter.com. Perlmutter, no period. drperlmutter.com. And interestingly, vis-a-vis our discussion on COVID-19, we have a huge repository of studies that I've been talking about online. All of them are are collected there and in their full PDF form. So that's totally free and available to anybody who needs some better understanding of the research.
Oh, that's fantastic. Well, we'll link to your site and also to your Facebook page where I know you continue to do these live updates on the science and really helpful, proactive, practical counsel that people can act on every day, starting now. Anyway, have a great day. Good luck with your next interview, and we'll talk again soon.
Thank you. Bye, Pilar.
Bye bye.